Vera.
Okay, so my son Miguel, he's age 28 now, but we had the opportunity to get TRICARE for him because I went through what's called qualified member status, meaning that he has certain medical conditions that he needs extra care for, even though I'm a reservist. At that time I was a reservist, but I was just coming off active duty, and active duty approved it. So I was able to continue and get TRICARE for him. But then all of a sudden, after the 5-year time frame, because it's every 5 years that they renew your coverage.
Right.
So after every 5 years, we're at the 5-year mark, and all of a sudden COVID hit. So I was like, well, how do I do this? And they're like, well, he would have to be declared disabled, which he's not. So if he is declared disabled, it would be an automatic renewal. But because he's not, then I would have to go through the whole paperwork thing, which I wouldn't mind, but I would have to go back to active duty, and I'm not. I'm in what's called the gray area. So I hit my mandatory retirement year. So the Army retired me at 33 years of service.
Wow.
So,
well, first of all, thank you for your service. That's the first and foremost, and genuine thank you.
And you've been she has been everywhere and done everything, so
pretty much.
So in this, so when they said either A, you go back to active duty and be deployed, or he can't get the TRICARE, he wouldn't qualify. So what was his option then? Where did he switch?
So then we went public. So we had to go, no choice but to get Medicaid.
Right.
So then how do you navigate that system? I had to learn how to do that. But thank God, that Dr. Tarantino was available and we can select them. And now we're with Dr. Tarantino, which is great. It's wonderful. But not a lot of people have these options, which is difficult to say.
We got that. We just got that set. And we just got another.
Yes.
Awesome. Well, I helped Dr. Tarantino start his practice. So I was his executive director. And now Becky is. So we have, so that's nice to hear. I'm glad to hear that. But I'm sorry you had to go through that. And I would say, for the people like yourself who live in expanded Medicaid states, that's so powerful that you have that as a backup option. We're finding that in those states that do not have expanded Medicaid, the issue with, the millions of people and loss of employer and sponsored insurance, if they don't have it, if they aren't income eligible, if they're in an expanded Medicaid state and they're income eligible, then they can get on Medicaid. But if they're not, then the only option is the marketplace. And then, they're going to be looking for the cheapest premium, right? But with the lowest premium is going to be the highest out-of-pocket costs. And so then, or a lot of marketplace plans now have skinny plans on them, which don't cover any pre-existing conditions or medications. And so there's just this entire upheaval. So I'm glad it worked out.
Yeah, but it was pretty scary for a moment.
Yeah.
But at the same time, my kid is 28, but still, he needs me.
Yes, he does.
We need to get insurance. We just cannot not have insurance.
Exactly. So.
And that's a good basis for an introduction. What we're going to do is just do a Q&A as other people join us. Ina, Alicia, hi, how are you? Can you hear us? You can unmute yourselves. You want to unmute yourselves?
Everybody being shy here or what?
Yeah, that's not like,
it's not like Illinoisans to be
and
shy.
It's not like either one of them either. So they're, so.
I'm an Illinoisan, I can say this.
Hi, Amina.
Hi, Bob. This is Amina. How are you doing?
I know. I'm like, that's not like her to be shy.
I just have my kids around. They are making so much noise so that
it's okay too. We're used to that.
We just discussed how we are used to this these days.
Yeah, that's true.
So you can keep it. So yeah, we're just trying to get out there some of all these questions that people are having, and really trying to And also too is some of the ideas we're recording this. We really do. Colette has become this and really worked hard to become this national expert about insurance and payer services. So to share this with some other people too. So,
Thanks, Bob.
Yeah, your questions answered, but also to kind of get some of this recorded to share with other people. So we were talking about Elvira's current situation, and it really, started to talk about is that, right now during COVID, if you happen to need to change insurance due to unemployment or, for any reason, and that was really, what to think about. And Colette, I think you were going down through a very good checklist. If you need to go to the market, is just really good things to think about.
I think honestly, Bob, I would use the opportunity while we're waiting for others too, but to send out a reminder. I don't know. I know you do your
yeah, we can.
monthly newsletter and whatnot, but a call to action is that, we know from Kaiser Health News that as of May 2nd, I believe it was, that there were 24.7 million people who were unemployed as a result of COVID. Now, that didn't mean that all of those people lost their employer-sponsored insurance. It could have been that they were on a furlough. It could have been that they were going to be rehired at some point. But then we saw more recently over 5 million people have permanently lost employer-sponsored insurance. So the challenge with where we're at today as a country, again, we have those who, in those states who don't have expanded Medicaid, who are really left with no options, because COBRA is most certainly unaffordable, but to go on the marketplace. But even in the states with expanded Medicaid, if there's some, if they have a spouse that continues to work and they're not income eligible and they can't go on Medicaid and they need to go on the marketplace, you really need to remind them about the direct correlation. When they're looking for plans, they're going to be searching for the lowest premium, because everybody right now is worried about money. We all are, okay? So if I'm looking for another expense, my insurance, and because when you had employer-sponsored insurance, your employer paid a certain percentage of your premium. Now this is your responsibility. So everybody's looking for low premiums, but the lower the premium, the higher the out-of-pocket. There is an absolute direct correlation. So, or like my own daughter who lives here in Peoria, last year when she lost her employment, she went on the marketplace for the 4.5 months in between jobs. And, listen, this is what I do every day, all day, but she did not ask me to make sure the plan she selected was the right plan, but she went for the lowest premium, and it was a skinny plan. And that skinny plan did not cover any pre-existing conditions or any of her medications. So she ends up with $4,000 worth of bills that were uncovered. Thank God that's all it was. Like if it was a hemophilia patient, that could have been a lot worse. So my point being, we really have to remind people, if they face that situation and they're unsure, they do need to reach out to you folks. And if you guys need help, obviously reach out to us. But to make sure they're not choosing a skinny or bare bones plan. And on these high deductible health plans that have the lower premiums, they need to make sure, because if there's a accumulator adjustment program on those, which for Illinois, you guys should be good actually on the marketplace, since they can't have accumulator adjustments if there's no generic.
Go ahead. Yeah, go ahead.
Now that's not for ERISA plans. That's not for self-funded, but it is for marketplace plans. So that should be protective of your folks. But just as a reminder, to be very careful of, checking into those things. And if they're because they have 60 days, right? So from loss of employment to getting on the exchange and choosing, the time is finite. And, we've had some folks even in Illinois reach out last minute and say, I have to know by midnight tonight. And it's that day. It's like, wow, give me a second. Because how do I find out if your physician's in the network or, So these are the challenges. Just to remind them of the time frame, and that, you know, the lower the premium, the higher the out of pocket. And, you know, and then can you confirm for me, Bob, in Illinois, the anti-accumulator bill is, they don't govern ERISA plans, but it should cover your marketplace. Have you heard of anybody with a marketplace plan since that legislation went in that had it?
It covers marketplace. It doesn't cover, you know, ERISA plans. You're exactly
Okay.
right. Yeah.
Okay.
The other thing is when you're looking, you know, and you're considering that checklist, if you're looking for a new plan, a question to ask too is that, is your deductible reset? So especially right now. So, correct?
Yeah. Yep. Well, I mean, you
So-
mean if you change insurance, is it reset with the accumulator, or is it reset because you changed plans?
Reset because you changed plans. So
Right. And it would be likely. I mean, that's the other
it would
sad truth.
likely be? Okay.
Yep. But I mean, the
But-
good news is if it doesn't have an accumulator, remember, folks, that before the accumulator adjustment programs went into effect, so let's pretend they don't exist, and you're on a drug and your deductible's $5,000 and that's your max out of pocket, but you're on a hemophilia drug that has a $15,000 card. Month one, you got your drug, the copay card paid your deductible and out of pocket, and you were done for the year. You had no more out of pocket expenditures, right? So you still theoretically have $10,000 left on that card that was never used. So if for some
Okay.
reason you switch plans, you still have money to use. Now, the accumulator adjustment, what that means, and again, Illinois is lucky, it's one of only 4 states that has an anti-accumulator ban so far. But you guys, so if it's a marketplace plan you choose, or you were on another plan that did not have an accumulator and your deductible's reset, you still should have no problem because you have money left. There's no hemophilia drug card that I know of that shouldn't cover this. I mean, they're all at least $12,000 or more.
Okay.
Just keeping in mind. But if it was an ERISA plan, meaning you had your employer-sponsored insurance was a self-funded plan, then they're not governed by the Illinois law, and so they can have an accumulator. So you could have theoretically maxed out your copay card for the year. So if your deductible's reset, Bob and whoever else in your department, remind them that PAN Foundation, the Assistance Fund, and Patient Advocate Foundation all have copay funds. And as long as you meet the income eligibility criteria, then it would count to your out of pocket. And so you should be okay.
Okay. And it is one thing we have to watch in Illinois, being an industrial state. We have a lot of self-funded plans.
Yep, you do. A lot.
And
Caterpillar, Boeing, I mean, you have a lot of them. Yep,
yeah,
big ones.
that the big corporations decided, what that just means is the big corporations decided to fund their own insurance.
Right.
And
So when I say commercial insurance or employer-sponsored insurance, what we're saying is your employer pays some part of your premium. So if you work for a company and they pay 80%, you pay 20, whatever, that's called employer-sponsored insurance. But of all that commercial insurance, some is self-funded, like Bob said, meaning the company decides, I'm going to take the risk. I'm going to put X amount of dollars aside, and they have an actuary tell them, you know, like where they should set that limit. And we're going to cover all of the expenses for our employees, and we're just going to use a third-party administrator. So whether that's United Healthcare or Blue Cross Blue Shield or whoever, they're going to use them just to administer the claims, but they themselves pay the bills. But now every self-funded company, for the most part, they have what they call umbrella insurance, reinsurance, stop-loss coverage, meaning they decide how much they're willing to risk on exposure, and once the claims should surpass that amount, then the insurance kicks in and covers the rest. So anybody who's in that situation, That's called a self-funded plan. That's an ERISA, that's governed by ERISA, not by the state. So therefore, state laws do not apply. So if you work for one of those companies that has is a self-funded company, you could still have an accumulator.
Now, it's also worth noting, and it switches the subject a little bit too, in those self-funded plans, they can also somewhat write their own rule or write what they cover and what they don't cover.
Yep, they're allowed to exclude disease states.
Yes.
And I will,
Yeah.
I don't want you guys to shoot the messenger,
Yeah.
but I will tell you my fear. I'm predicting that we're going to see some real changes, because even though this has been allowed always, there's been very few companies to actually pull that trigger. It happens. We hear a few a year. But for the most part, companies are fearful of the backlash or the potential, litigation that could potentially come. And are they picking on a certain disease state? Well, the rule says as long as they exclude everyone, they can't just say, well, your son cost me $1 million. We're not going to cover him anymore, but we'll cover other hemophilia. No, it has to be all hemophilia or all specialty drugs or all chronic conditions. They can choose. But I'm hearing a lot of scuttlebutt that self-funded plans are talking about, because of COVID and because of the financial economic impacts, they're at least having the dialogue about really giving careful consideration to high cost disease. And they can say, we're only going to cover $2,000 a month on specialty. I mean, they can set the rules, and that's a situation that I hope I'm wrong, but I'm afraid we're going to see more of that than we've ever seen coming in this next plan year.
Yeah.
Can you explain what's an accumulator?
Yeah. So the word accumulator, let me define it. Every year there's a maximum out of pocket, right? That's your maximum out of pocket. Any plan has. This year in 2020, your max out of pocket, the most they can have you spend out of pocket is $8,150 for an individual, double that for a family, okay? So now if you're the health plan or the pharmacy benefit manager and you're trying to track how much money each patient has spent as they're getting to their spending their out-of-pocket amount, because once they hit their max, then the payer is responsible for the rest. So what they call that amount is your accumulator. That's your accumulated out-of-pocket expenditure. So before accumulator adjustment programs came about, which was back in the beginning of 2017, when you used a manufacturer copay card, that manufacturer copay card was applied to your deductible, applied to your out-of-pocket. Once you met that, then you had met your deductible and out-of-pocket, and so your accumulator was met, you met your max, and you went on. An accumulator adjuster means that they have a program and they identify those payments that are made. And if somebody makes the payment on your behalf, i.e. the manufacturer pays your deductible and your copay, then on the back end, they reset your accumulator to reflect only what you yourself have paid.
That's wrong.
And if you
That's
haven't,
dirty.
and if you haven't paid it yourself, then after that card is used in month one, giving my example in January, if they took $5,000 off the card, on the back end, they go in and they reset it and say, John Doe here, he didn't pay anything himself, so his accumulator still shows he's paid nothing. So come February, you owe another $5,000. Well, the card still has $10,000 on it, so they take another $5,000. And then they reset your accumulator. March, same thing. But now after March, your card's exhausted. You don't have any more for the year. And then they say to you in April, how will you be paying your deductible and out of pocket? And that's the clip. That's where patients are really finding themselves in a very precarious situation. And it can be, out of pocket can be all the way up to $8,150. And that's the problem.
Now, where the idea came from was lower cost chronic disease drugs that people were not spending anything out of pocket, that the drug companies wanted those people that disease states such as diabetes that people were not adhering and following, like,
Well, the example to use, Bob, is like Crestor
yeah,
or Lipitor.
that they
So
weren't following diet, they weren't changing any,
no, that wasn't the reason was because they have generics
okay,
and they're low cost. So if I go to the pharmacy counter and my insurance says, Colette, your preferred drug list only has the generic for Crestor and Lipitor. And so you can get that generic for $5. But if you choose to get the name brand, you have to pay $150. And I go, oh, well, I want the generic. But then I find out there's a coupon the manufacturer of Crestor has issued.
okay.
And they
thank you.
say, the pharmacist says, hey, you can use this coupon. And if you use this, then you only have to pay $5 anyway. Oh, well, good, I'll take the Crestor. But on the back end, the payer now has to pay significantly more money for that name brand drug. And that's where this kind of came about. I was like, this is not fair. You are incentivizing patients to use the higher cost drugs because you're level setting the cost for them, but we get stuck on the back end. And so that was the purpose of thinking, the rationale. However, they really are just targeting specialty drugs that don't have generics. Hemophilia being a perfect example. That's not a case that we would ever deal with. And so, and even MS, who has a generic for one or two of their products, you know, the name brand is $86,000, the generic is $63,000. Both of them are way more than anybody can afford. Both of them are way more than a deductible would be. And so therefore, regardless of a generic or a name brand, we are not talking about $5 drugs. We are talking about drugs outside of anybody's ability to afford them. So it affects our population in a very negative manner. So that's what we've been fighting against.
Yeah. And we got a law passed in Illinois. As she said, we're one of the 4 states that did get a law passed.
It's a big deal. Yep.
So,
good job, Bob.
No, yeah, it was one of the chronic disease.
Well,
yeah.
I mean, you were part of it too.
Yeah, no, but it was,
credit.
yeah, it was. It's working as a coalition, so it was good. Yes. So I think insurance we've covered well.
Yep.
Yeah. So, so unemployment is another big issue. The biggest thing in Illinois is that the system is very antiquated here. So many people are, because of COVID, there's been so many people apply, and the system has become, it was antiquated in the first place. It's very much a paper system is the way I understand it. So it's been very overburdened. So people have been waiting for long amounts of time to get their unemployment. So, so on top of everything else, they're waiting weeks on end. I still know people that are waiting, 10, 12 weeks, and they are not getting their unemployment. They have not gotten their unemployment. So
my youngest son, they owe him 16 weeks, Bob.
What?
My youngest son, they owe him 16 weeks of unemployment, and he still doesn't have it. And he tried to recertify, but they won't let him certify because it says that it's in processing. So he still hasn't gotten the first check.
I've been assured by everybody that he will get it. He will get all the back. Now, but tell us about all the other consequences. Is he living at home or?
Oh yeah, he's living at home, and I'm making his car payments though. But here we go again as parents. It's like we still have to step in
so he has a safety net.
Yeah, but it's just difficult,
But there's the thing is what's happening when the safety nets aren't there.
Right, that's right.
Now we've been talking to people of when those safety nets are not there, what do you do? So.
Right.
So all what we've been advising is to, be that self-advocate, and we are helping advocate is that, call your state congressman, call your state senator, call your national congressman, call your national senator. Again, you're going to continue to get pushback from them, but definitely have that registered. Make those calls, because.
Do you know if Chuck Weaver is on any of the committees that would be served by that? Because he's a good friend. I mean, he's a state rep. I'm happy to reach out. I just think that's egregious to think 16 weeks is.
It's a matter that the system needs to be. They're not going to get it.
Well, my daughter who made the bad selection on the marketplace last year, she was furloughed for 4 weeks from the hospital, and so she did have to get unemployment, and it came after she went back to work. But I want to say she said 4 or 5 weeks. I just texted her. Like, that's one thing. This is ridiculous. Like, 4 or 5 weeks is still hard. She has she has her kids and a home, and she doesn't have me living in the area to depend on. But still, I can't even imagine. This is huge.
We've done okay because, they're not allowing evictions, but it's putting pressure on the entire system because cash is not flowing. So the other thing is that, when you don't have money, you don't have food. So it's one thing to not be evicted, but you can't buy food. So, so that leads me to two other things, though, too, is that we do have resources. So with the emergency assistance programs throughout the bleeding disorder community, people have been generous and have supported expansion of those emergency assistance programs. So we have been putting that out there. We're not getting requests the way we should be getting requests. So, and we expanded it to provide food coupons. So, we will send it.
So have your son apply.
What?
I said, have her son apply.
Please. It really is that the thing that's very hard right now with COVID is that I can see her face right now is like, oh, I donate, I shouldn't be asking, and that's not it. It is for the community. So, there's programs now. Just call, and we have a space on our website with all of those resources.
This is for my youngest son, Bob. It's for my youngest son.
Good. Have him apply.
Really?
So call me. Yes. It's $100 worth of food. It's not a miracle,
Yeah.
I'm not going to solve anything, but if we can put some resources in the pantry and it can help, why not? So everybody, that's what it's been there for.
All right.
So there's rental assistance, there's utility assistance, and it's there because that unemployment is delayed. So it's there to get some cash back in that system. And we got the money to help make that, so that's what it's there for too. The other thing that is a new resource that we just found out that we're really going to start to promote is something called AuntBertha.com. And Colette, I don't know that have you come across Aunt Bertha yet? You're muted.
I haven't done anything specific with it. I have heard.
It is phenomenal, and we're starting to learn about Aunt Bertha. Mm-hmm. We decided not to go forward with that grant because of learning about Aunt Bertha. You just go in and you type in your zip code and you type in what you're looking for, and they'll list all of the resources in your community. So I would challenge every one of you on this call tonight to just, like, for example, after this call, put in food resources, and they'll list, you can put in within 5 miles or 10 miles, every service that provides food within 5 or 10 miles of your house. And it's a nationwide, they have 40 people working for them around the clock to keep that database up and fresh and correct. And then the other thing they ask is that if you find something on there that's not correct, to like, they have a response there to say it's not correct, to keep it correct. So it's a phenomenal service right there, especially now and to just try to keep us all to kind of those daily living stuff. So Elvira, it's another thing that many of us don't know about, though, is the food stamps.
Right.
And is it SNAP program?
It's a SNAP program, and
So
you can just go online to https://abe.illinois.gov. And you can apply for medical, food stamps, and there's another program called TANF, and it stands for
What was that?
TANF, Transitional Assistance to Needy Families. And basically, you have to have children under age 18 under your care. And right now, we're getting a lot of single dads, which is amazing that there's single dads out there, but there are. And it's quite easy. Within 24 hours, you get approved or denied, depending on your situation. But we're working that fast to get food stamps and medical.
What kind of criteria?
Well, I can send you a chart, and it's based on the income, the number of the people in the household, and of course, you know, your citizenship, residency, and that's it. So even non-residents who have kids that are citizens, they can get it for their kids.
Great. If you can, and so if you send that to me, I can put that link on the resources.
For sure.
Okay. So, because we can put that up there, that'd be tremendous too. And what does it provide? So is it very?
So it gives them, so if you apply for medical, you know, you're gonna get a Medicaid card. So don't look for a plastic card. It'll be a paper card. It'll just be an 8.5 by 11 sheet of paper, and it'll show everybody, and you can actually cut it. Yeah, but before we used to give them an actual plastic card, but now it's just a paper card, because you know the army, the state is cheap. And if you get a link card, obviously you'll get a link card, but you have to activate it through a landline. So a lot of people don't have a regular house phone, they just carry a cell phone, but they actually have to find a landline to set up the link card and select a PIN that they'll be able to use every time they go to the store.
Okay.
Can you tell me where that resource is, please?
Oh yeah, it's www.abe, like Honest Abe, abe.illinois.gov.
Okay.
Yep.
Thank you.
Yeah, so I'm a caseworker for the state of Illinois Department of Human Services. So I work in the Blue Island local office, but we can see anybody in the state. So if you have a question, I can look up your case and just tell you what's going on with your case. Or sometimes I can even process it. I can tell my supervisor, hey, I know this person, which I can't touch if I know them exactly, you know, like a family member or friend.
Right, right.
I can't touch those cases. I have to give them to her, and then she has somebody else process it.
Right.
She's been a great resource.
That's awesome.
So that's, again, I don't tell people your name, but it's one of the things we put out there is that we know someone.
Yeah.
And then we call.
Yeah. And even if, you know, you say you think your income is too high, we were told not to cancel the medical. Basically, we're just leaving it open. So we're not even canceling if you get like $1 million in unemployment. We're just leaving it open.
Right. So are you talking about for Medicaid?
Yep, Medicaid.
Yeah, because Medicaid, I think the question came in really fast and furious with the whole $600 a week add-on, where was this going to affect because your normal unemployment is counted towards your income criteria. However, the extra $600 a week does not.
Right.
So that's good. Very good.
And actually we were splitting it. So that way the system won't read it.
Oh, good.
Yeah, but now that it's ended, we were told to go ahead and end it. So that way, oh, but during the COVID months of March, April, and May, let's say you only qualify for like $50 in food stamps. Well, we were giving you the max for your household anyway.
Nice.
Yeah.
That's great. Well,
Mhm.
that's nice to know.
Yeah. And then there's the pandemic application for food stamps for kids. So basically, if you had kids that got, you know, a lunch meal at school, and now they're home, and now the link card that you have is not enough to feed all your kids because they actually got a lunch at school. Well, you were getting an extra link card just because of the
Yeah.
food that, you know, you have to spend for your kids. And I don't know if that's going to continue, but that can also be a paper app, or they can go online, and I can send you all that information to you, Bob, so you can see it.
Thank you. And then we'll share it.
Yeah. Yeah.
Great.
Yeah. So I don't know what's going to happen, you know, when August, September comes around, but I'll always keep you up to date on that.
Yeah, we can.
Mhm.
So, I just want to open it up. This has been great. So for just other questions then. Maria, Amina, Alicia, do you have questions?
Oh, it's great. I mean, you guys have so many great resources. I was just wondering if we can talk like a bit about school reopening, because I have kids in K to 12, so I'm really anxious right now. I would say I don't know what to expect, but our district is planning to reopen the schools. Yep.
I mean, it's unfortunate, but I think it's such a politicized discussion. It's almost hard because I think I'm stepping outside of my role. I don't think there's a right answer. I don't think there's a wrong answer. I think so again, this is personal, okay? This is Bob. This is not the executive director of BDAI, Amina. So I think you have to sit down with your family, with your husband, and you have to put everything on paper, pros and cons, and what you believe, and you have to make the best decision for your family. And it just is, and then if tomorrow something changes, you're welcome to change that decision. And then, just, I don't know, because this isn't easy. We're living in a changing world every day, and no one truly has it. You don't have all the facts, so you just.
Yeah, it's true. I really don't know.
You really don't know. So it just is, and you just hear so much, and people are so charged about it. I mean, it just put a bet in. I mean,
I think the best thing we can do is just to keep saying, let's keep politics out of this.
I know, but it's
let's
just
keep politics. It is hard because we're way past that. That ship already sailed, but I just keep saying it. I just keep, because like there's the facts, and then there's the political gamesmanship, and we got, we have a disconnect.
And I think it's so hard, Colette, too, because we don't have all the facts, and
well, I mean, we have enough facts to know that.
Yeah, I know.
There isn't, and while there's a likelihood the majority of otherwise healthy people will have a hard time if they get it, but they'll get over it. Okay, I get that. The fact of the matter is up to 20% require medical attention.
Right.
Medical attention to breathe. They're overwhelming our hospital resources. We're filling the hospitals so that people who have other conditions aren't able to get in. Like I started out with, for some of you who weren't on, someone in the community lost their life. A younger person because when they went to the ER, were sent away because they were only dealing with COVID instead of getting the appropriate attention, and they had a brain bleed. So the problem is, while those aren't counting to COVID deaths, the fact is the hospitals are so overwhelmed and overtaxed because they are required to help. And, you know, people who have, you know, chronic conditions that are not hemophilia, that is not really, there's not an additional risk with hemophilia specifically, but you know, the question has been asked of us on a regular occasion at NHF, does hemophilia affect it? No, not specifically. But, you know, some of the, like, for example, some of the gene therapies, if people are on the clinical trials and they're on the immunosuppressants that are required, then there is a risk if you're on an immunosuppressant. But there's a lot of people who live on an millions of people who have arthritis or, you know, who take immunosuppressant drugs that have a much greater risk. And so it's the greater good kind of thing. You just, if we would all just wear masks, then we wouldn't have to worry about shutting down again. The problem is everybody, you know.
Land of the free. Yeah, land of the free. We can.
Hey, when I go to the grocery store, it says no shirts, no shoes, no service. So it is a land of the free, but if I choose to be barefoot, I'm not going in. That's just the way it works. So.
You and I are on the same page.
No, I know, but I'm saying is I think sometimes we have to reset and go, I get it. Yes, it is the land of the free, but this is a health deal. It's not
no, I know. I was being
I know you were. Trust me. I know you were.
I was being very facetious.
But this is the kind of thing I have to keep reminding people is separate the politics and let's just talk about it.
Yeah, no, and it just is. And I just, and I mean, we don't even talk about, and again, I'm stepping personal. It just is.
Right. Same here.
I recently looked at a yearbook from my high school, and I mean, I just had my 40th year reunion, and there are teachers still teaching at my high school who taught me. And I mean, I thought those people were old and here they were really just starting out in their career. And so, and I mean, I loved those people and I loved what they did and I still revere those people. And now, you know, I'm thinking about that. I haven't been at that high school for 40 years, but I'm invested now that they're expected, those people now that I'm 60 years old, so they're definitely in their, you know, 70s and 80s, that they're expected to go back to do what they've been doing for this many years, that they're definitely vulnerable. So it's not just our children we're being asked to, it's our teachers and our administrators and, you know, and our cafeteria workers and our janitors. They're all going to be exposed by our little petri dishes. I mean, our children have always been, my sister's name is Neva, and we called her Typhoid Neva because whatever was going around the valley, she got first and she passed it to everybody, you know? And I mean, she's a wonderful person, but I don't know what, Neva just had the immune system that she would pass everything to everybody. And so children are little petri dishes, so.
They are.
And I don't hear much talk about, you know, the vulnerability we're expecting all those, you know, so it's not only what we're asking our children, the exposure we're putting our children to, but what are those children going to do to.
My husband's company, they've lost 4 now, all of them under the age of 60. One was 28, none of them with pre-existing health conditions. I lost a high school friend. I'm 56. So, I mean, I guess you call that on the cusp, whatever you want to call it, but it's not. And young people, there are 18 kids in New York were in ICU that were under 18, you know, because it's now evolving into some other morphing or whatever you want to call it, into some other things causing other organ issues. We just don't know enough. So it's like, let's just all just try to do our best. And that is I mean, we're talking personal now too, because it is.
It is. And it is more than personal, I believe, right now. I have kids that I have to send to school, and I have a husband who teaches. So I don't know. I mean, I don't know where to stand.
You have a beautiful family. I wouldn't want to see them hurt at all.
Yes, yes.
Family, so.
It is really stressful for me to think like the both ways, like send him to work and send my kids to school, because I have to go to work as well. And he was lucky enough to work from home over the summer, but now he doesn't have this liberty. So
I know. It's the what ifs and all of that too. So
yes, yep.
We will be here to support.
So have they announced the school where you're at, Amina?
Yes.
Like, what's the go to school strategy there?
So it is like 2 days in person and 3 days e-learning. And the kids with IEP or 504s, they are, I mean, for them, it's 4 days of school.
Okay.
So,
yeah.
And because of the bleeding disorder, do you have a 504?
We do not. We never applied for that. I don't know why.
That's okay. No, that's okay. I just didn't know if that, because in that situation, it might be almost a hindrance that it forced you to have 4 days,
Yeah, no. I'm glad that he is just going to go to school for 2 days.
Right.
But,
I was just saying that.
Yeah, but my husband will be going 5 days.
Yeah.
So.
Well, and there you can learn about too is that, coming in and out, taking the clothes off immediately.
Yes.
That's
what I have been doing from last 5 months, because I work in a healthcare. I work in a healthcare place.
Okay.
So I have been doing the same. So I guess now we all have to do the same thing.
Yeah. And I mean, you set it up as routine. So yeah, you do. And it gets to be, I don't know.
It's tiring and exhausting right now.
I don't know if it's fun is the right word. I grew up in a farm family, and I mean, just sort of my parents made things fun. So it just was, we worked in working on a farm, there were very dirty things and you had to keep bacteria separate. And so my parents made things fun, and you got incentives for not bringing the bacteria into the home. So it really is they did, you got points for, I just still remember, you got points for from a little kid on. So to not,
Yeah, so. I tried points, but now those points are old.
I know. I know. But it just was, I still just remember just they did from one to teach us.
This is off the subject completely of really the fixes necessarily, but we've over the last generation, we've seen such a change from our generation where you were out and you played, or these things you're talking about. Kids can be in the same room. I have 3 adult children and 2 grandsons, and they're texting each other sitting in the same room. Like the communication is so different, or they're not out playing, or, and then now the fear, like, how do we even, like, I feel like when I went to the store, and of course I had my mask on and stuff, and somebody bumped me by accident, like just the stay out of my space thing is so much different. I'm like, are we going to recover? Or are we all going to be this way where we're not going to talk and want to get closer, shake hands, or I don't know. It's scary. There's a lot of unknowns, so.
What are your thoughts about the new, the next relief bill, the next, about the new, the unemployment, the $600 running out, and the
and stimulus check.
Yeah, the new stimulus.
Many people are looking for that check. That's what I know.
So let me ask you guys. This is probably going to be potentially a hot button question. Not political at all.
Or hot button.
But a hot button. Because do you think that the $600 extra a week is a help or a hindrance to people wanting to go back to work?
I believe it's both. It depends on your family needs. So for some families, it was really helpful because I have seen people struggling for just a basket of food for each week. And for them, that 600 was a good thing. And sometime in some families, only one person can work. And if he's getting that $600 extra, I guess it was a big help for them. But there is a flip page too.
But how much unemployment, like if you got unemployment because you lost your job, well, how much is unemployment in Illinois? Is it 60% of your money or 80, or does anybody know? 60% what you would have gotten, or 80? It's something like that. So you not only get that plus the 600. Now, I totally agree with you. I mean, I think that for a lot of people, heck, they couldn't barely make it on what they were earning, let alone taking some away. But what we found down in Florida is a lot of the service industry refused. Like when the businesses got the relief money so they could continue to pay their employees,
They wouldn't go back.
they wouldn't accept the checks. They returned them and they wouldn't go back to work because they made more money in this situation than that situation. And so a couple restaurants ended up shutting down because none of the staff would come back. So it wasn't because of COVID specifically, it was because it was the conundrum of, so I just,
There has to be a new creative way, because there are some, and I have an example too, is my nephew who has worked, he's younger, he's in his early 30s, and he has worked all of his life and has worked really, really hard, and a new wife and a young baby, but he never had any time off. This $600 he's making now than he was working, and he's seeing this as a vacation.
right.
And he's riding. He chose not to go back to work. And what I worry about, and I was really, really trying to encourage him to go back to work and bank the $600.
Yeah.
And get a, he's not looking for a job. He's trying to ride this out, and just had the time of his life this summer.
I kind of feel like they could have saved a ton of money. And I'm not saying there shouldn't be other resources for those people who need it, but by just, instead of giving them 600 more, and if your unemployment is 60% of your normal salary, make everyone whole, like take them up to their normal salary, whatever that is. And then extra for those people who have some needs-based sliding, type of thing. I'm all for that. But when it's people who really didn't need it, but it's actually more than they would have made. I mean, I think it should have go to the people who need it is more what I.
Yeah, or my Big Cool program too is if you go back to work, there's something for 2 or 3 months when you go back to work.
True, that's good. I didn't think of that.
Yeah. And does anybody know if you didn't get the first? I've had a number of people that have called who did not get the first stimulus check, and I've not been able to. I've looked everywhere, and I've called the IRS, and I've had if you didn't get it, who do you call? Who do you talk to? Does anybody have any resources or know?
Well, I can send you. I don't have it off the tip of my tongue, but our son in California, the check did not arrive. And so he had to file this thing, and they did like a 12-week tracer, and then they're going to do something to reissue it. So he still doesn't have it, but I have the process. I can get you the process of whatever that is.
That'd be great, because I can put that on the resource page too. Some people ask about that.
Yep.
Okay.
Is there a possibility, Bill, Bob, for you to do a survey in the community in Illinois, asking people if, just a few simple questions. If you could not use the manufacturer copay assistance to help you with your medications, would you be able to afford your medications. I think the fundamental question, yes, Illinois has a law, but the ERISA plan isn't, as we said, ERISA plans are not governed by the law. And I think also with this CMS language that was issued for Medicaid best price rule, which has now got pharmaceutical companies saying we might just do away with these copay coupons if they make us do this, which I'm not necessarily going to get into what this is and whether that'll happen. So, but the question, I think, in order for us to gain traction with legislators, they have to see how big of an impact this would be. Just asking the question, like, how dependent are people, especially with a chronic or rare disease that have a high cost, high value, meaning life and death drug they need, how dependent are they on that assistance?
So either you and I, can you and I talk about this, or will you send me this? And
I'll send you the questions that I am kind of.
Because we've got that grant, and I need to get started on a project, and so it'd be
Okay.
So we'll push it off and we'll get it going. So that would be great.
All right.
So thank you for this.